Hi, good day everyone. Thank you for your time. I am Yorilyn and today I'm going to talk about stroke awareness. It is important that we are mindful and understand the devastating effect of stroke and be well prepared to deal with the life changes that strokes brings because this health problem plays a huge burden on the affected individual, family, and society. By the end of this presentation, you will learn about the negative effect of the strokes that can have on everyone and how we can save lives by being aware of the warning signs and risk factors of the stroke. Now let's move on to the introduction. To begin with, let me tell you the impact of a stroke on the person who suffers from it is truly the most important aspect of stroke. What could be more terrifying and devastating than losing the ability to talk, to understand others' voice, to lift an arm or leg, to stand, to walk, to balance, to hear, to see, to read, to feel, to write, or even remember? It is the most common cardiovascular disorder, which refers to problems with the circulation of blood that affects the heart and the blood vessel. Stroke has been the second leading cause of death in most countries around the world for a very long time, according to World Health Organization. Approximately 800,000 of people have a stroke each year. That is about one every 40 seconds, and that's quite a lot. Stroke incidence increases due to unhealthy lifestyle. Smoking and heavy use of alcohol are well-established risk factors for stroke as well as other serious medical diseases. So that completes my introduction and now I'm going to explain what is stroke. Stroke is a brain injury caused by an abnormality or interruption of the blood supply to a part of the brain, preventing the brain to get sufficient nutrients to function properly. Rapid loss of brain function is when a part of the brain does not receive an adequate supply of blood or nutrients it needs. That part of the brain will not function normally, and the brain cells die in a minute, so the timing of treatment is critical. The treatment must be sought as quickly as possible because stroke is a medical emergency. The first common term for stroke is apoplexy. Well, in Greek, literally means struck suddenly with violence. The word stroke refers to being suddenly stricken. Stroke can be tragic. It is a disorder that can change the very nature of who a person is in a split second by dramatically altering brain function. Okay, I've explained what is the meaning of stroke. Now let's move on to the next slide, which is the type of stroke. Strokes can be divided into two major types, hemorrhage and ischemia or ischemic. Hemorrhage refers to bleeding inside the skull, either into the brain or into the fluids surrounding the brain. Hemorrhage is characterized by too much blood inside the skull, while the second major type of strokes are called ischemia, that refers to a lack of blood or not enough blood supply to allow to continue normal functioning of the affected part of the brain. Brain ischemia is much more common than hemorrhage because 85% of stroke worldwide is ischemia, while 15% is hemorrhage, but it is more fatal and have less chance of survival who suffers from it. Ischemic can be separated into two types. First is thrombotic, which refers to a blood clot forms in an artery to the brain. The second type is embolic, that refers to a blood clot forming elsewhere in the body, heart or neck. Also, hemorrhage have two types. It's the intracerebral, meaning weak blood vessel breaking inside the brain, and the other is subarachnoid, refers to a weak blood vessel breaking on the surface of the brain. Now let me show you the next slide, which will give you a better understanding on the two major types of stroke. The pictures on the left show what is ischemic stroke looks like. As you can see, there is a blockage in an artery due to blood clot that stops the flow of the blood and nutrients that is needed to that area of the brain. If you notice, that area of the brain turns gray, which means the brain cells already died. Let's look at the picture on the right side. It is show how the hemorrhage stroke looks like inside the affected area of the brain. The weakened blood vessel wall was ruptured and blood leaks into the brain, and that will cause a deadly stroke. Moving on to the next part is the TIA or transient ischemic attack. A clot or blockage in the brain causes TIAs. The blockage is only temporary. The clot usually dissolves on its own or becomes dislodged, and the symptoms and temporary loss of brain function usually last only for a short time. TIA is sometimes called mini stroke since their signs only last a few minutes up to 24 hours before they vanish. A major warning stroke, on the other hand, is a better label because a TIA frequently precedes a full-blown stroke and should be taken seriously. As you can see in the picture on the right, this has a similarity with ischemic stroke, but the only difference is TIA only makes temporary blockage and will eventually disappear. Okay? I explained how TIA occurs, so now let's move on to the sign and symptoms of the stroke. Strokes occur quickly, and as such, symptoms of stroke often appear suddenly without warning. They serve as warning signs for future stroke and indicate that there is a partially blocked artery or clot source in the heart. So immediate action is needed once experienced the following symptoms. Depending on which part of the brain is affected, patients will also have different symptoms. Now let's take a look at the picture to learn all the possible symptoms of stroke and what to do in case it happens. Moving on the next slide, it's about the risk factor of stroke. In this slide, I have listed all the modifiable and non-modifiable risk factor of stroke. Each person should become aware of their own personal risks and behaviors that can put them at risk of for a stroke. Some risk factors are out of one's control. For example, age, sex, family history of stroke are all risk factors for stroke. But knowing main modifiable risk factors and learn how to treat and avoid them are all effective preventive strategies. Hypertension and the risk of developing a stroke have a well-established relationship. The single most important risk factor for stroke is a high blood pressure or hypertension. In a very common problem, other risk factors such as unhealthy lifestyle can be changed to avoid risk of a stroke. Now that's all for the risk factor of stroke, so we are going to the next part in which is the prevention. Here I have listed the 6 ways we can do to prevent and reduce the risk of having stroke. The best way to prevent a stroke is to address the underlying causes. This is best done by living healthy and avoiding those vices such as smoking and too much alcohol. According to Dr. Kaplan, it is preferable to practice primary prevention or avoiding a stroke before it happens. Many medical risk factors and situations that increase stroke risk start in childhood lifestyle changes, and steps to regulate blood pressure, cholesterol levels, and diabetes are also part of primary stroke prevention. Moving on to the next slide is the rehabilitation. Rehabilitation assists people who have had a stroke in relearning skills that are suddenly lost when a portion of the brain is damaged. The goals of rehabilitation are to improve the person's ability to function after a stroke, as well as their level of independence, and to achieve the highest possible quality of life. Every year, approximately 800,000 people worldwide suffer a stroke, with approximately two-thirds of these people surviving and requiring rehabilitation. Protecting the individual from developing new medical problems such as pneumonia, urinary tract infections, fall injury, or clot formation in large vein is also important in rehabilitation. So now we have come to my last slide. Let's take a good look at this picture, and it's very important to educate ourselves on the warning sign of stroke and do it fast. In case we experience any of these symptoms, it's time to call 911. To sum it up, I'd like to end my presentation with a simple message. Stroke is a very serious disease, and it will surely alter our life drastically if we are hit by it. Trust me because I have experienced it firsthand with my father, who is until now still suffering from the devastating effect of stroke. It's been 14 years of suffering, and all his family, relatives, and friends is affected because of this disease. So, while we have the opportunity to live healthy, we must do it now. That's all. Here's the list of references that I've been used in this research. I'd like to thank you for taking time out to listen to my presentations. That concludes my presentations for today. So now I'd be interested to hear your comments, and I will try my very best to answer all your questions. Thank you and have a good day.